So today, first I will do a short recap of what we have done in the last 3 days. So first is we learned how to get data, the literature data from the NCBI. And NCBI has its own query builder with several different combinations, search engine sort of, which helps us to obtain the relevant data that we want, literature data that we want. Then subsequently, we use R packages and carried out some text mining and built also some word cloud infographics. Then next day, we went to PubData, which is basically entity recognition in the literature text, and along with it is the data normalization to Anthrax gene ID by the NCBI PubData engine, and then part of it how to process it in the R environment to obtain data on large numbers of papers using the PubData engine. And then we moved on to use that data and look at networks and a little more details about the functionalities of the different entities, most notably genes that are present in the literature corpus. So genes is our fundamental genetic unit, and that is why there is a lot of research going on with the role of different genes, how they are regulated, how they are connected to their neighbors, and how their variations they are connected to the disease processes. So we saw that in somewhat detail, and it was easy to do because we had normalized data, namely the Anthrax IDs, and we cleaned it up a little bit by removing the missing values and also repetitions in order to get hold of the most important pathways that are statistically highly significant at the false discovery rate, low false discovery rate from the string database. That is just one route to obtain further knowledge from the text mining. Why do we do text mining? We are doing text mining because we want to get knowledge. That is the main goal here. While doing text mining, we learn some skills. We learn some scripts. We learn some packages and so on. And skills you can forget, because if you don't use it, then you will forget. So it depends on the practice. But knowledge is not so easily forgettable. So from the skills, you get knowledge. So the skills used to process the data, and then from there, we try to get knowledge using text mining. That's the idea. Now, today, I shall show you some examples of what exactly the authors have described in their research papers about a given gene or an entity like microRNA and so on. So, one approach is that we again go to the same pubtator table we obtained. So I shall start sharing the screen. So you can see here, this is the R Studio, and I have uploaded the ABS abstracts and the word table. And what did we have here? Say, for example, in the first paper, we had this gene ZFAS1. Then there is an miRNA also, which is MIR-7-5P. Then there is another gene called ACSL4. Then there is another gene which is zinc finger antisense 1, but that is same as ZFAS1 because of the normalization. Then glutathione peroxidase, and it is also, its symbol is GPX4, and then acyl-CoA synthetase long chain family member. So these are the genes. Even miRNA is a gene. So these are the genes which are reported in this paper. It is possible, in principle, that the same genes may be investigated in multiple papers, either because the two groups were more or less moving and coming to the same type of study. In science, this happens quite often. Or independently, they got evidence in different contexts and experiments on the same set of genes. That is also possible. So we start with investigating with a function called it's called give sentence. So the name of the function itself suggests to you that it is a function that will give the sentence in which a given word will be present, word of our interest. And sentence is a part of the text where the authors describe about the gene. So let's try that. And I write like this. So you can see give sentences. There are two functions are there. One that will give sentence from the abstracts which are loaded here, and another it will take the sentence from the full paper from the NCBI directly. So give sentences and we give the term ZFAS1 and say DB retino ABS. So we can see here that it has created an object list of 2. That means it is a list object and there are 2 elements in this list. Let's see each element individually. So in the first element of this list, which is given by double square brackets, there are multiple sentences present in that. So one element of a list may contain multiple data. That is the list structure in R. One element doesn't mean one item. Okay, so that is how the list object type in R gives this facility. So here it gives the title LNC RNA. So it happens to be a long non-coding RNA. ZFAS1 positively facilitates endothelial ferroptosis via some miRNA, which happens to be MIR75P slash ACSL4 axis in diabetic retinopathy. So in this one sentence, the author has given exact title of the paper, looks like, and in one sentence, the author has connected the long non-coding RNA gene and how it facilitates positively or negatively. So positively in this particular case, and it does it through a process, some other entity. So it doesn't do it directly on its own via media. And in that media, the items are microarray ACSL4 genes in diabetic retinopathy. Then comes the other sentences which basically describes their work done. And then finally, in conclusion, it says that whatever experiments and work they did, our results demonstrate that high glucose, Hg is high glucose, you can see here, induced Z of AS1 elevation activates ferroapoptosis in HRECs, which are human retinal endothelial cells, and the Z of AS1 microRNA ACSL4 axis may serve as a therapeutic target for endothelial dysfunction. So there is some change in the regulation of this gene that is happening, and that is connected to diabetic retinopathy. Also, in this third sentence here, so we are not reading the whole abstract, we are jumping, sort of jumping to those sentences where the authors have written about this gene. So they have done some validation. They say that ZFAS1 may act as a competing endogenous RNA by competitively binding with the microRNA. MicroRNA is also a regulator. And then this ZFAS1 binds to this microRNA and serves to modify its function and modulating the expression of its downstream. By doing this, it is modulating the expression of its downstream molecule, that is acyl CoA synthetase long chain family member, which is now identified as a classic driver gene of ferroapoptosis process. So in one sentence, the authors have essentially explained the role of this long non-coding RNA binding to the microRNA, and then eventually that has a effect on the expression meaning from RNA to protein of this acyl CoA synthetase long chain, and that eventually could affect the ferroapoptosis process in the disease. So one path of the disease mechanism, we are able to get knowledge just by reading this much. Now let's look at the second one. So in the second list element, which it says based on previous research, we have developed a serum-based multi-panel PCR test using 9 LNC RNAs, and in that they had included ZFAS1. They have included other LNC RNAs also. This is not the same paper. See, the PMIDs are different. The second element of the list is from another paper who are also studying ZFS1 along with other LNC RNAs to identify and validate whether this panel could be used as a diagnostic or prognostic tool for DR. So this is something that they are investigating this, and they are investigating based on previous research. And in the serum, that is blood sample, they are doing this multi-panel PCR test. And for that, they go on describing how they did it. And then finally, we can see that they have reported that significant increased LNC RNA expressions of ANRIL, H19, hot air, HULC, MIAT, WSPR, and ZFAS1 were observed in the serum of diabetic patients with varying stages of DR compared to non-diabetics. If you excuse me, I'll have a little glass of water and come. Sorry, what? Just 1 minute. Now, let us take a second example. So, here we have, for instance, other sets of miRNAs also as well occurring in other papers. So, let's look at MIR 93. So we repeat it. Let us see what we get. Okay, here we can see some data has come. List of 5, meaning from 5 papers. So that's 2, number 1, and let's see what it mentions here is that there are 3 sentences where MIR 93 is mentioned. So it says that they have done some work because of which the hypothesis changes in the serum of MIR 93 and 152 in diabetes and diabetic retinopathy. So from here it looks like people are trying to find some kind of diagnostic way to follow the process of the disease, whether the disease is coming or probably, whatever, however informative it can be. So in the second sentence, we can see that sort of approach is measured, approach is described. Serum fasting and 2-hour postprandial glucose fasting, that is the early morning after 12-hour fasting. Glycated hemoglobin, fasting insulin, and HOMAIR were evaluated by routine methods. MIR 93 and MIR 152 expression by quantitative real-time PCR. And what did they get in the result? So FBG is probably fasting blood glucose, 2-HPP and fasting insulin showed an increasing trend, including the MIR 152 across groups, while MIR 93 showed a decreasing trend, and the statistical p-value is also given. Now you might have heard that I said probably something like that. So one way to sort of know this is we can 2-HPP is this one, 2-hour postprandial glucose. 2-hour, postprandial, that is after breakfast and after 2 hours after breakfast. So that one, then fasting insulin and all these other molecules like MIR 152 and MIR 93, they showed some differences in the patterns. And the most significant predictors of PDR, which happens to be part of this disease, so we can sort of there is a function called head abbreviation which actually can help sometimes decode these abbreviations. So let's see whether Sorry, we need to know the PMID for this. So rest 2, the PMID is 35996507. The first one. The first one. The first one is this 35996507. That's the PMID of the paper. So here is the head abbreviation where give limits, and we say the term FPG, and then we have the PMID. It's a number, so it should not be given in quotes. 35996507, and then the abstract corpus, which happens to be this one. So the author looks like they have written it as FBG without first mentioning what it is. Sometimes this happens in papers. They simply directly go ahead, and if the editor does not, editorial assistant does not catch it and say that the first mention of the abbreviation should be full form, then this type of things can happen. So we assume that it is fasting blood glucose, which is a reasonable assumption in this particular instance. And we can also try to see if HOMA IR is also explained here. No, it is not coming. So that means the explanatory part of this abbreviation is not appearing in this case. So then we have no option but to look for if even in this particular case of so HOMA IR is probably not, it's not a gene that we can know from here from the pubdata table. So it is some other method, and then we have to use other Google search and other methods to know what it is. Let's go to the second paper. And here again the microRNA 93 is there, and there is only one entry here, and a direct relation between the dysregulation of MR21, MIR93, MIR221, and FPG, HbA1c, and HOMA-IR was identified. So this the PMID of this paper is happens to be this one. So what we can do is we have a function called PMID to abstracts, where we give this PMID and we write this ABS, And this way what we get is the abstract along with the journal of that paper. So if we have the PMID and the abstract corpus, then you can get that particular uh, paper abstract using this PMID to abstract function in the package. So these functions are from PubMed minor package, and as you can see that here also HOMA-IR, it has not been expanded. So it is simply mentioned like that along with many other LNC RNA genes. Many times authors write like this because they have a limited number of word limit, 200 word limit or 250 word limit. 250 is rare. Usually the word limit is 200. So in 200 word limit, they have to write all what they want to write. They have to give the background, they have to give the methods, results, and conclusion. So they simply write like this, and then in the full paper they will go and explain the each of these abbreviations they write. So these are the difficulties of text mining, principally because of the limited space that the authors get to write. And then here you can again see that the LNC RNA is written with a dash. So here also authors are not decided on a standardized nomenclature. They are, you know, writing it differently. Each case they are writing it differently. So this way we can keep
Sir,
ah,
so can you show the above command if possible?
yes, this one. Now this PMID, where did I get? I got it from here, from the previous group. Then this is the command. And this is an S4 object, so that's why this word slot is coming here. You can see the word slot comes. Now, let us try to do a slightly different kind of data mining or text mining. Suppose we want to identify two words that are co-occurring in the same sentence or nearby the same sentence. You may recall that in string also this co-occurrence was being used. So we can do that here also. So for that, what we do is we simply say my result or something like that, and use this function co-occurrence advance. And you can see we have to give the abstract first, so DB retino ABS, and then the term 1 is, let us say, the disease itself, and that can be given as diabetic retinopathy. I'm using the function C, or DR, which is a short form of diabetic retinopathy, and some other terms, that is the term 2. It can be treatment, or it can be diagnose, let us say, or it can be therapeutics or therapy. Okay, we can try that. And we have to say whether I want it in the same sentence or one next to another, or one alternate sentence, means first and third. Up to that point, we will consider as close proximity. If something is mentioned beyond that, the two terms, then we can simply think that no, the authors are not joining in the same context. The two words are going to be used in different contexts. And let us say we don't want that. So we go up to 2, which is first and third sentence. Up to that, we can allow freedom. And this is happening in the entire 10,000 papers of diabetic retinopathy. And let us see what we get. Okay, so it has, excuse me, uh, it has done the job. So we can see that these are the results. So this is a data frame, and we get this PMIDs of the respective paper, the particular sentence where both the terms are there, and we can see here that both the words are occurring. The treatment word is there in the last line, and in the fourth line you can see diabetic retinopathy is there. And here it tells which combination it has got. Now we see here something interesting, which is called senolytics in the treatment of diabetic retinopathy. So what is senolytics? So let's again go to PMID to abstracts, and now put this PMID 3609. Even I don't know what is senolytics. I'm seeing for the first time. 3609 1769. So senolytics are a new class of drugs that can selectively clear out senescent cells from the retina, thus holding a significant promise in DR treatment and prevention. New class of drugs. And some examples are again given here. We also discuss the current state of pharmaceutical development at preclinical and clinical stages, focusing on the senolytic drugs. Senolytic, so senescence lysis. It looks like they have coined the word like this. Senolytic. Uh, Navitoclax 17-DMAG, then piperlongumine, UBX 1325, dasatinib, quercetin, and so on. So they are in trials now, and presumably soon they will become available. So this is how our knowledge increases. This is really very nice that at one go I never knew anything like senolytic exists. And suddenly today, in front of you, while doing it, I come to know what it is. This is the beauty of text mining using a computer and algorithms. We can scroll down and keep going to know what all is happening in the treatment. And yesterday, see here, yesterday we saw some antibodies against VEGF, right, in the KEG site. And here we see that they are doing intravitreal injection of anti-VEGF antibodies, meaning they are injecting in the eye, has been widely used in the treatment of proliferative diabetic retinopathy. So this is already in the use. That's what we saw in the cake also. This is a general statement. Specifically also by taking those names, we can try to find out. So here there is another conclusion of a particular study. While anti-VEGF therapy is a useful tool in the management of proliferative diabetic retinopathy and diabetic macular edema, it is believed that physicians should avoid over-reliance on anti-VEGF injections in the treatment of diabetic retinopathy. So you also have to have some kind of a guarded way of using this treatment. That's what this particular paper is saying. And if you want to read it more comfortably, then you go to this, and probably it's the 39 number, I think. Yes. Now here you can read this same thing Earlier, we were trying to read by moving the mouse cursor over the uh, sentence on the data frame in RStudio. Now here in the console, we can read it very comfortably. We don't have to do anything. So this way also we can try to get the data. So a lot of anti-VEGF agents are mentioned in these research papers. So people might be studying this with regard to their efficiency. Then it is also the practice, once a particular molecule or a agent is found to be working, then immediately people will try to make its variants, different compounds and so on. This is part of pharmaceutical research. And then they will try to patent it differently so that they get different marketing rights, territories, and so on and so forth. And then they will do research and report it in the public domain in peer-reviewed article. They must do that because then only it can come to the market. Then only the DGCI will give the approval. Except in very emergency situations, this is the normal process of drug research and reporting. And we get to see this detail. So now let us look at some of diagnostic parts also. So here it says that optical coherence tomography and its angiography have several advantages for the early detection and diagnosis of diabetic retinopathy. So this is again a new term that I have learned today. Optical coherence tomography. We know computer tomography, and that is used in the medical diagnosis. And here they are trying to come up with a different medical procedure, and that is again studied, investigated thoroughly, and reported in a peer-reviewed journal. And the basically ocular imaging is what is used here for detecting. That's not very surprising. It seems to be very obvious for detecting diabetic retinopathy. And what they are saying is that the ocular imaging technology itself is developing probably, and it's playing a significant role in this. Now, here is use of artificial intelligence again coming, whether they can be used for automated retinal diagnostics. So, this type of investigations is happening in the diagnosis field of diabetic retinopathy. We have seen treatment, now we are seeing diagnosis. And now here is therapy, which is also related to treatment. And here they mention that there are new targets like the arachidonic acid metabolites for treating diabetic retinopathy. And let's see what else we have. We have this FAC therapy, and where they again mention that there is a favorable evolution and a clear regression of the DR severity. So this way we can see that by choosing the words of interest, which have some meaning, like medical meaning or a scientific meaning. Scientific meaning, the examples I showed were the genes, mRNAs, scientific meaning. Okay. And the words which are having medical meaning like treatment, diagnose, therapy, we are able to get different phases of the knowledge of diabetic retinopathy. So, how you choose your words in doing this type of analysis is the key thing. That is where the most important experience, whatever you call it, that is where it comes. And this comes, through repeated engagement of such text mining again and again, and doing a lot of nonsense activities, and then finally coming to some selected uh, words which have a meaning. The other option is you talk to experts sometimes. Then they will be talking in this terminology because they are experts. Catch those words or phrases and or note it down in your notebook and then use that to carry out certain text mining activity from each of the corpus. But you can see that what we got from gene just now, what we got from gene and what we got from these other terms which we use, the data is very different. The data is very different. One is coming almost totally to medical field and another is molecular biology research. Almost 100%. Very different. Some common data points are there. That is the VEGF. So, every gene and every molecular biology process that we study does not go towards therapy or a treatment. It may not. but some of it would eventually go to that stage. mRNA research is happening now. Who knows? Some RNA therapy may come in future. Maybe that is a future direction. So this way you can try to look for future possibilities and accordingly develop your skills or develop your projects. Then the funding agency will also be very excited to fund those projects because they look like they are futuristic, not dead and beaten projects. So with this, I close today's session. If you have any questions or comments, then we can discuss them. What I have shown is only a tip of the iceberg. The more and more you engage into doing this using the methods that I have described here, it will help you a lot. And that is my best wishes to you.
Thank you, sir. I have little doubt actually. I'm running side by side on
Yeah.
my other machine, and I'm getting this error. It's called error in and colon fix doc ASP invalid argument type. What does that mean?
What did you run?
I'm running this program, the abstracts.
No, you have to tell me the exact command you used.
I'm using word cloud.